from the T cell perspective, what we found was that even though both the responders and the non-responders had this influx of both CD8 and CD4 positive T cells post-treatment, that the quality of the T cell response was different between the responder and the non-responders. So firstly, there are certain markers that are associated with tumor-specific T cells that were highly upregulated only in the responders. And secondly, we actually use plasma samples from the patients who were collected through the treatment to understand whether there is a tumor-specific response that was generated as part of the treatment. And the way that we did that was we took the baseline tumor samples and performed whole exome sequencing and RNA sequencing to understand the specific neoantigens that are present within the patient's tumor. And we had generated peptides using such information to test against the plasma samples that we collected while the patients are on treatment. And what we found was that only in the responders was there a systemic anti-tumor specific response that was generated as you go along the treatment. And that was not seen in the non-responders. So it's very curious to see that phenomenon where in certain patients, there is this cancer-specific response that's induced systemically while it was not seen in other patients.